Thank you so much, Kamran, and thank you so much, the International Society of Neglected Tropical Disease. This is the second time that I'm having this chance. Last time it was last year in July, I think, when you took me in to talk about youth engagement on NTDs. And I'm glad that at that time also I got a chance to join the SADC Youth Health Committee, where, as we have said, one of our resolution was that member states should adopt the new NTD roadmap so that to increase the focus of these NTDs in countries, member states. Now, I want every one of us to understand the Southern Africa Youth Forum is the regional platform for youth and youth organization within the SADC region. During the second Youth Forum Declaration 2020, among other resolutions, the young people led by the Able Health Committee called for member states to effectively comply to the new WHO NTDs roadmap. Now, 2021 is a very crucial year for NTDs. It has really been a momentous years for NTDs. I want you to know that it is within this 2021 that we have celebrated the launch of the new NTDs roadmap that happened in early of February. But again on 28th, we had the launch. We celebrated a World NTD Day. Now, as I've said that SADC Youth has taken NTDs a very crucial way. That's why we wanted to have a very special way to celebrate. That's why we wanted to have a special way to celebrate the World NTD Day, but in other words, to think and see how far we as youth can work. And we, as we were trying to show as we wanted to show our interest on this, we did the two things effectively. First thing we did a campaign. So we as SADC Youth did a special campaign that aimed to increase the awareness of NTDs in our communities, to our fellow youth, and to awaken our government responses on NTDs. But the second thing that we did was the press release. We did the press release so that to increase the awareness and the concentration of partner organizations and societies to see that we as SADC Youth have given this way. Now, how can you support us? And to this, I would like to thank the International Society of Neglected Tropical Disease for their concentration and taking it serious on to our thoughts. That's why the International Society of Neglected Tropical Disease has become our first partner to join us and support us. And as we are starting the Connect series today, we will have much and many more series in days to come, where we are going to highlight several entities aspects in our region. Now, I want to introduce to you now, talking on the SADC Youth Task Force. What is the SADC Youth Task Force? SADC Youth Task Force on Entities is a group of young people under the SADC Youth Health Committee from all SADC member states assembled to address the neglected tropical diseases. So we have aimed to start this task force so as to assemble the ideas from our fellow youth across our region to address the issues regardless to neglected tropical diseases. So we want to increase the awareness, we want to increase the concentration of youth to join the force, but we want to awake and help our governments to increase the concentration. Now, we have to focus now on the reason of forming a task force. Why have we decided to form this task force? The first thing is to highlight areas of entities that need the most and immediate attention. You know, talking of entities, we are talking of 20 neglected tropical diseases. So having a task force, will help us realize what are the most and immediate places that we may increase our attention. For example, dengue has been a very deadly disease nowadays, and it really affects many countries in Africa. Now, having a task force will cite that currently in this country, dengue is the problem. In this country, Guinea worm is the problem. In this country, elephantiasis is the problem. So our task force will be specific, will focus specifically to highlight where and where exactly we need to increase an immediate attention. But the second thing is to increase the health committee focus on NTDs. Our health committee focuses on general health aspects, COVID-19 and the rest regarding health. But having the task force help to concentrate the health committee's efforts on NTDs. So having this task force increase the efforts of our health committee to fight NTDs. But the third thing is increasing efficiency of combating NTDs. We want to increase the efficiency of combating NTDs. Having our health committee does not guarantee the efficiency because it gives us a wide range to move here, to talk about this, to talk about NCDs, to talk about whatever. But having a special task force that answers, that seeks for more information, that seeks to advocate for NTDs, gives us a motive to increase the efficiency of combating NTDs. But number three, the chance to concentrate on major areas of interest. You know, in our health committee, it includes different people with different interests. Now, we as the health committee, we have come up with this task force, and it will include all those who are just passionate. Not just because you're a member of our health committee, you'll be entitled to in a team of entities. No, we want members of health committees who have that passion and interest to fight NTDs. On our focus, our task force will be a multi-sector, considering the following. So we want to have a special task force that is a multi-sector, considering the following. First, because we need support. Now, if our task force is a multi-sector, gives an opportunity to get support from several stakeholders. Our task force will be a multi-sector, considering that we want many more stakeholders' involvement in fighting NTDs. We as the task force cannot. The government cannot themselves. So we need this task force to be multi-sector to provide a playing ground for many stakeholders' involvement. But the third thing is high information spread. Having a task force that is multi-sector, it provides a new way where our information about entities can highly spread. Because if we do at our own at the task force, and the rest stakeholders take their time to speak or to advocate about entities, we are pretty sure that our information will highly spread. But number three is community cooperation. We need our task force to have that community cooperation effectively. Now, if we are having a community cooperation, that means our intention will easily reach the community. We want our information to reach the community. We want to reach the community in a better way where they can understand our concept about entities. Now, having several stakeholders that we are in several sectors gives an opportunity for the community to receive information about entities in several and different ways. But the last thing is involve people's decisions. Having a multi-sector task force provides an opportunity for us to see and hear what the community can suggest, what other stakeholders can suggest. And if we are having different knowledge, it can help us to improve our decisions on better ways to combat entities. Now, what our task force will involve. Now we need to understand what our task force will involve. The first thing, we need to involve individuals directly affected by entities. We need to involve directly people who are affected by entities. People who are affected by entities have a better way to tell us what exactly the entities means. You know, neglected tropical diseases, to me and to the sense of our task force, it bases on the neglected people with these diseases. Now, involving them shows that we end the neglect we have been causing to them, we have been giving them. The second thing is proactive, passionate, and interested youth. We really need proactive youth leaders. We need to have passionate and interested youth leaders who are ready to understand, to learn, and to increase their energy in fighting the NTDs. But our task force will involve those working with the affected entities. Sometimes we may fail to get the affected entities, but we may work with those who are directed, we may now work with those who have stayed, or with those who are working with those who are affected by entities. For example, the healthcare workers. The healthcare workers are dealing with the entities patients. So working with them or involving them will help us in our task force. But the other thing is government officials. Of course, we need government officials to help us in this. Government officials will help us in policy changes, policy implementations, like improved water and sanitation and wherever. But the other issue is partner organizations, as it has now for the International Society of Neglected Tropical Diseases. So we really thank you guys for showing us a way, and we are happy that through partner organization, like today, our conversation today reached thousands of people. Now these thousands of people gets to understand what are the NTDs, and this is what we want. And the other issue and other group of people that we will involve are other stakeholders like member states, and as we have said, the partner organization. And our task force looks to involve the following: business leaders. We need the business leaders who can help us to allocate the resources. But we need clergy and faith leaders. As we all know that these people tend to listen to their faith leaders sometimes. So we need their involvement so that they can help us on advocating for these diseases in their community. But we need people with high standing in their community. They are famous people in our communities. These people will help us on advocating because they have got a massive followers. But we need people who have access to money. You know, these activities sometimes needs money on advocating, needs money on allocating these massive drugs and whatever. So we need resources and money actually, so that we can disperse these resources. But we need people who are who have power and convenience to the government, because if we get them, they can also help us to influence our campaigns in different ways. And the last group that we focus to involve are people with access to target population. So the targeted population currently is youth, because even in Africa, youth takes the large number of people, and youth have a massive influence in Africa. What is the expected engagement? We expect the engagement from youth, older adults, media, schools, as I have started a campaign and started the NTD clubs in schools, for example, in my region, where I get a chance to speak to the schools about NTDs and respectively dengue, which is the project that I've been doing recently in most cases. But we will focus to the engagement from youth saving organizations, law enforcement agencies, civic and volunteer groups, state, local, and governmental agencies. Yes, now on my closing remarks, this is what I can say, that NTD-free generation is possible by 2030. So by this time, I'm sending a motivation to every one of us that we need to increase our concentration and hate NTDs. I remember I participated in a World NTD Day storytelling competition, and I'm glad that I was shortlisted. And I think I was shortlisted because of one thing I said, that we need to hate NTDs, because it is not the neglected tropical diseases. These are people these are neglected people with diseases. So if we hate the fact that our fellow citizens are neglected because they're having certain diseases, it will lose our concentration, our focus. And we now need to integrate resources so that by 2030, every country, any country in SADC member states is left behind. Now, focusing on the World Dengue Day campaign, this is one of the they are talking on dengue. This is one of the deadly diseases right now, and it really affects many regions across the globe and in African countries as well. Now, I'm glad that our task force will also focus effectively on dengue and especially campaigning for the Dengue Day. We really need a World Dengue Day so as to increase the concentration, concentrations and attention, and to pull attention of stakeholders to focus on dengue effectively. Now, I'm calling upon you to sign our petition that is provided in the scene link, and we also share globally that we need a World Dengue Day. So please get in and sign for our petition through www.change.org. Set the World Dengue Day petition and sign there. We need to influence the UN, we need to influence the WHO so that to increase the concentration and fight against dengue diseases. And this and much more will increase the focus through our task force. Now, thank you for joining us. I'm glad that you have been here with us and had a chance to listen from what I've prepared. Thank you.